Why worry about nerve stimulation surgical risks? Imagine going in for a procedure that could help improve bladder control or assist in bladder cancer treatment. While nerve stimulation surgeries can be very helpful, they also come with certain risks that deserve attention. These risks are connected both to the surgery itself and the devices implanted to help manage bladder issues. Understanding these risks helps patients and doctors make informed choices and prepare for potential complications. During surgeries like sacral nerve stimulation or nerve blocks used in bladder procedures, there is a chance that the nerve blockade might not work perfectly. If the nerve isn't fully blocked, patients might experience sudden muscle jerks or contractions in the leg or groin during the operation. These involuntary movements can make the surgery more difficult and increase the chance of accidental injury to the bladder or nearby blood vessels. For example, the obturator nerve is close to the bladder, and if the needle placement isn't precise, it could damage the obturator artery or vein, leading to bleeding or hematoma. Since these procedures involve inserting needles or devices near sensitive nerves and blood vessels, there is always a small chance of nerve injury or vascular damage. When it comes to devices like sacral nerve stimulators, which are implanted to help control bladder function, there are additional risks. These include infections at the implant site, skin erosion, or pain around the device. Sometimes the device can shift from its original position, which might require additional surgery to fix. Technical problems such as device malfunction or the need for reprogramming can also occur. Patients with these devices should avoid certain activities, like applying heat to the area, because it could damage the device or cause injury. Older adults or those with other health conditions face higher risks from anesthesia and surgery. Anesthesia can sometimes cause complications, especially in patients with heart or lung issues. Even with careful anesthesia management, reflexes in the nerves might still cause muscle contractions during surgery, making the procedure more complex. Regional nerve blocks, which are used to numb the area during surgery, also carry risks. These include local anesthetic toxicity if too much is used, nerve injury, or bleeding under the skin. Fortunately, when performed by experienced clinicians using guidance tools like ultrasound, these risks are generally low. While these risks might sound concerning, it's important to remember that they can often be minimized with careful planning. Selecting the right patients, using advanced imaging techniques during surgery, and closely monitoring after the procedure all help reduce complications. Patients should always discuss their medical history and concerns with their healthcare team to weigh the benefits against the potential risks. In the end, nerve stimulation surgeries can be very effective for bladder health, but like all medical procedures, they require careful consideration of the possible risks. Being aware of these risks allows patients and doctors to work together to ensure safety and achieve the best possible outcomes. Always consult with qualified healthcare professionals to get personalized advice and to understand what's best for your specific situation.